Do you have some non-sterile, and then we will change for sterile, okay? I just want to check first the position. Casimir, relax, okay? Relax, everything is perfect. We go a little bit down. Doesn't want, huh? I will adjust, okay? I will stay like this. If you want to place a camera here and one there, chair disable. Good. You will stay with your hand a little bit this way. Do we have some spray?
Yes.
What's this? Lidocaine. You see? This area. Krasimir, you have to open wide. I will be quickly, but you have to open, okay? Spray. That's okay. You will feel a little bit of infiltration. Yeah. I will do only local infiltration. It's enough usually. Are you okay, Krasimir? Good. Okay. For the cheek. And I will go open wide, wide, wide. Okay, great. One more, please. So local infiltration is enough usually. Buccally and lingually also. And a little bit right, Casimir. Great. Excellent. And in the meantime, I will show you there is a special kit for the guided. All the burrs have the stop. Yeah? Can you place the camera on this, please? This is the AnyReach kit, and as you can see, this is only for the guided. Yeah? And you have an initial drill, a second drill for the cortical, and then all the 2.0, 2.5, 2.8, 3.3 are calibrated as length. 7, 8.5, 10, 11.5, and 13. Yeah? And as you can see on the tray, this is for 3.5 diameter implant, 2.8 preparation if the bone is weak, or 3.3 is the bone is hard. For the 4.0, it's 3.3 or 3.8. For 4.5, it's 3.8 or 4.3. So it's logical. You have to keep in mind that you know the dimensions of the implant and you know the dimensions of the burr. And then you have to make the relationship between, to feel the bone, between the density of the bone and the diameter of the hole and the diameter of the implant. This is all. We have insertion tools. These are the insertion tools, and we insert all of this through the guide. This is the idea. And we also prepared the regular kit of Megagen. And I was telling you that I'm harvesting a lot of bone only with the burr. We're preparing the site. Why? Look at the shape of this burrs. Yeah? This is the shape of these burrs. And these lamellas that we have here, you can keep it. These lamellas are great for harvesting bone. Yeah? And we will have bone lamellas. I will show you when we begin to harvest the bone and to mix it with the allograft. We check the position of the camera. Is it okay? I will stay like this. You have the retractor? It's okay for you? And I will use this. You see?
Yes, yes.
You can come from this area also. You can come from here, because I will stay in the back of the patient to give you the best area of... It's my head? I have no solution for that. I cannot work without my head. It's okay? It is better to come from the front? No, it's not better. You have to see from here. I will try to stay backwards, okay? Well, a bit. I will show you now the guide. This is the guide. This is the guide. These windows are for sitting the guide on the teeth. And these are the regular holes for the implant placement. These are the holes. This we will use. This we will use. And this is only for setting the guide. And how we set the guide, we just place it and taking a look if the guide is seated on these windows. You see? It's one window, the second one, and this is the third one here. And I will use directly only through these holes, keeping in consideration that the guide should be perfectly seated on the teeth. Yeah? So I will keep it very strong in this position. I don't want to move the guide. Yeah? And this is the situation. Do you feel pain, Casimir? No. Good. And now? No. Okay. Please tell him that will be liquid, and just to be relaxed, you will make suction of the liquid, and if the liquid goes in the back, he can swallow it. It's nothing. It's sterile. It's not a problem. Okay. I think we can begin. This is the initial drill. With this, we go through the mucosa and we just make the position of the implant. Let's see, this is 800. Yes, and with water, can we place more water? We have to take out the internal. We don't have the internal place. Close. Darf ich neue Handschuhe haben, bitte? 8, bitte. Und hast du etwas Spülung, oder? Gut, danke. So we don't make cuts, we don't put stitches, everything goes through the guide. Thanks. It will not be a wound, so it's like preparing a filling. Huh? This is reduction handpiece, no? Yes, it's reduction handpiece. And this is, no. Where? This is the, oh, it's okay, but I don't know how to place it. Ah, okay. Good, perfect. I will begin with the first burr. I'm waiting for the water. Okay. So, put your head down, Casimir. Okay. You can see? No, leave it like this. So, with my hand, with one finger, I keep the guide in the back, and with this finger, I keep the guide pushed on the teeth. And I will begin here. Yeah? Very slowly. I don't push too much. I want to feel the tissue. Yeah? Come with your head like this. Do you see something? It's okay? Good. And we go with the burr. And you see how nice is harvesting bone, this burr. You can read, you can take it. Look, this is the bone on the burr. You can see it? No, here, you can see it? Yeah? That means the cortical is strong enough to keep my implant. Casimir, to the right. Ah, yes. Okay. And then we go on the back. Here is more difficult in the back, but we will do it somehow. Good bone. Tell him to breathe on the nose. Yeah? Again, this is the bone. You can harvest the bone if you need to augment the site later. So this was the initial drill. What I did with the initial drill, I went through the mucosa and then I was preparing the cortical, only the cortical. And then I go with the second drill. Can you place something on me not to be... This is the second drill. This is also for the cortical. No, put you have an operating dress or something? On the right. Put your head on the right, Casimir. Yes, this is. And we continue with the second drill, in which we observe that we have cortical. So the bone is quite dense here. I'm just pushing and I'm leaving the liquid to go inside. So I'm not pushing too much. I don't want to overheat the bone. Yeah. Thank you. Good. You see now I have a spongiosa also on this burr. You can see the burr on the field? Yeah. This is with red. I have also spongiosa. With the first drill, I had only the cortical bone. It's important to feel the density of the bone. Open, please, Casimir. It's a bit hard here with the opening, but we will handle it. Open, 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 open. Okay. Section, yeah. Open, 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 open. Oh. Good. The bone is very dense here in the back. So, and I have a lack of space here. Open. Oops. Well, and this is what we have now. Can you make a... Can you see? These are the holes. Yeah? And now, we know that the first one is 11.5 and the second one is 8.5 because we planned it. And we reposition the guide. We just let the patient to breathe a little bit. And we go on the whole length of the implant, 11.5, with this burr. 2.0. And then we take 2.0 with 8.5. This is the length of the second implant. Open, open, okay, perfect. And now we go with the next diameter. This is 2.5. 2.5, 11.5. Yeah, it's written on the burr. 2.5, 11.5. Yeah? And we go on the first hole. Okay. And now we take 2.5 with 8.5 for the second implant. It's a little bit hard, the position. But we can do it. Okay. Let's check again. Yeah? And this is our surgical field. Nothing more than this. Yeah? We replace the guide. Okay. And we go with 2.8, 11.5. This is the next. So we expand the bone slowly. Yeah? And 2.8, 8.5. And I go with the burr up to the end, up to the last level. Okay? Big, big, open, perfect. Super. And now we want to have the 3.3 here with 11.5. And you see, I have again spongiosa on the burr. Here I will go with the cortical drill only in the back. Open, open, okay. Good. And 3.3 cortical drill. Everything's okay? 3.3 and then it's 3.8. Okay, so right now we have prepared the site. And I think is enough. And now we prepare to place the implant. So we prepare the whole length up to 3.3, and this is the core of the implant. And then we prepare up to 3.8, the cortical only. And we expect to have a very good stability in order to immediately load the implants. If we don't have enough stability, we just leave the implants and they will be loaded later according to the situation. Okay, so this one, 50, okay? No, that's okay, 50 is good. 50 is good and no water, huh? Yeah, perfect, good. Okay, let's see. We check here, okay. We check again the position. I will show you now what we ended up. This is what we did. This is what we got here. You can see. This is our surgical field. It's minimum trauma for the patient. And we have the gingiva, the attached gingiva. And now we will place the implants. And we plate to have a 4.0 with 11.5. We need a guide again. And the only problem here is the space. We will have very less space with. So 4 with 11.5. Yeah, break it. Break it, take it, and then remove it, and I will take only the green part. Yeah? I will take the green part. Okay. So this is the implant. It's like a Lego piece. You see? You can give to your kids to play with. I remove this one, and I will take the implant with my piece. Yeah? Now, this is the implant. You can see it. This is the shape of any ridge. And we have a 4 with 11.5. The problem is the space here. And we just slowly insert the implant. Do you feel any pain, Krasimir? No. It's good. Okay. So we have a very good stability of this implant. Maybe too good. We need the extension here. We have extension, we have extension. On the right, the head, your head, on the right, okay. And open, Krasimir. Okay. It works perfect. Great. And now I take the dynamometric key from the other side, and I will see what is the torque that I have. Oh, look, 45. You can see? No, please tape here this part. Record, please read this part, yeah? 45, yeah? Easily 45. So I have very good stability without compressing too much the bone. And I go, Krasimir, to the right. Put your head to the right. Great. And that's all. Now I will show you on the mirror that the green part is okay. Can you see on the mirror that the green is in the window? Yeah? The green is in the window. I take everything out, if I can. I could. And I check the implant with you, of course, to be, where is the perio probe? I don't see the perio probe. Perio probe, no. No, yes. Yes, perio probe, good. Because I want this implant to be a little bit subcrestal. And it is now perfectly 1 millimeter subcrestal. Can you see it? No. You see me. Good. The implant is... I cleaned the mirror, but it's scratched the mirror, unfortunately. And now? You see? Good. My head. Good. Perfect. You see it? Everybody sees it? It's the perfect setting, as planned. Let's continue, and now I will need a 4 with 8.5. And this will be more difficult because I don't have space, and Krasimir is a little bit tired now. And this is my problem. I have too many instruments on the table. It happens at the hospital also, yeah? So I use only 3 and I have 100. Yeah, okay, open it. Some of them I don't know what is the use of that instrument. Yeah, the blue one. The second is a blue. So the colors of Krasimir is blue and green. The same, and I take the small one. Where is the pedal? Okay. Good. This is shorter. This is an 8.5. Why? Because at the second molar, the nerve is up. Okay, don't touch anything with the implant. Open, big, big, big Krasimir. Okay, great, great, great. Open, big, big, big. Uh-oh, we have a problem here. Open, come on. More, 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 more. Hey, yes, bravo. Bravo, bravo, bravo. One more second. One more second, Krasimir. Great. Open, big, big, big. I go out with this. Open, big, big, big. Good. Perfect, guy. Super. A little bit more, and you are free. Big, again. No, no extension. Uh-oh. Don't take our instruments, Krasimir. Don't take it. It's all right. Beautiful. I feel the strength of the bone here. One last effort, Krasimir. One last effort. You are today's hero. Pain? Little pain. So we explained too much and we didn't do enough anesthesia for the patient, but we still have a bit. Okay, open. Open is the last move. Okay, is the last move. Look. Look at the torque. This is the insertion torque. That means we were lucky to prepare well the bone. You have to feel the bone here. You have to feel it very, very good. And then the green thing, and Krasimir has 2 implants already. Yes, I can. No, this is the end of our surgery. Very tough surgery. Here is the bone, 1 millimeter under the bone. It's beautiful. It's great. 1 millimeter, you see? You can see, eh?
Yes.
I don't know if everybody can see, but we will try at least. You have to trust my amazing assistant that everything is okay, huh? Bone, bone, implant. And this was the heart surgery. No sutures, no scalpel, nothing. And you saw the insertion torque is over 45 Newton centimeter. If I would have an ISQ, I'm sure it will be over 70. So I can load this. Yeah? What should I do now? I'm preparing a little bit the bone around. Very, very delicate. Let's throw everything from here. Bravo, Krasimir. You were great. And I was quick. I don't know how late I am, but no, it's okay. It's okay. go a little bit for the bone profile to verify the bone profile, to be able to place the crowns. And for the crowns, I will invite my best prosthetic doctor, Dr. Yachev, Daniel, to help me come, because I'm a surgeon and I don't want to make the crowns. We need the crowns. Yes. Okay. I just want to place the crown. This is 36, yeah? I will show you what we have already prepared. We have the provisional crowns already. So we will show people this. Oops. Hard surgery, huh? Very difficult. So this is the crown. Huh? Where should I place it? Here? Can you do it? This is the crown, and we have also the screw. This is a non-hexed crown because we don't have much space here, and we want to be sure that we can do it. Sometimes this is the most difficult part for me. Good. We need a longer. But this is the brand new kit, and it's very, very sharp. You see how unskilled I am with the teeth. Yeah? That's why I'm a surgeon. I realized it in time that I cannot make teeth, so. Open, Krasimir, okay. First crown in place. It's good, huh? The guys worked very well, the guys from the center. And let's try the second one. I think this is the position. This will be hard here, Krasimir. Open, open, open. Open, 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 open. Good. Bravo, Krasimir. Bravo, bravo, bravo. You have two beautiful implants in place already. Yes, it passed. So it's perfect. Please take a look at the prosthetics. Can you focus on this? Yes, please. These are the crowns. We have keratinized gingiva. Yeah. We have space between the two implants in order Krasimir to clean it. Yeah. and we have perfect stability. And now I will ask Dr. Daniel Yachev to do the occlusion adjustment because I don't know much about occlusion. Yeah? Only to place the bimaxillary surgery in place. Okay, thank you so much. I think it was very clear and sharp. And anybody can do this surgery, no? It's not a very hard surgery to be done. But the planning is very important. And the thing is to feel the bone. Yeah? What is the danger? The danger is not to be able to place the implant because the hole is too tight, or you make the bigger hole and your implant is loose. The idea is when you reach the implant at the level, you have to have at least 45, like you said. So now the implants are super stable without pushing too much the bone. It's that balance, it's very important. But you will feel this. It's nothing to be seen because you just go through the holes, but it's just to be felt. Begin with the lower engine speed and try to imagine what you have seen on the CBCT. Yeah? Cortical, where is the cortical? On the lingual is bigger, and the buccal is thinner. And press it, and then you escape from the cortical, and you have the spongiosa. What is the advantage with spongiosa? You can push spongiosa, you can compress. You cannot compress cortical. That's why the last 2 drills that I have used, it was only for the cortical, nothing for the spongiosa, because the spongiosa is pushed by the implant. It's a tapered implant. It's not the cylindrical one. This is amazing, and this is also a little bit harder, but when you are used with a tapered implant, with a little bit more aggressive implant, you will see that all your protocols will be shorter. And you will do this in maybe half a year, 1 year. In 1 year, you will treat your patients in half of the time, or even better. Because this implant is very well designed. And the connection for the prosthetics is only one connection. Yeah? For 3.5, for 4, for 4.5, 5, up to 6, you have the same connection, the same platform. You don't have narrow platform, regular platform, wide platform. You don't know. You have 100 screws in your closet. No, you just have one prosthetic, and this is very easy. You don't have to know what is the diameter of that implant. You don't care. It's an any ridge. It's the standard prosthetic connection, and it's a conical connection. It's very tight. It's 5 degrees. It's very stable. You saw how hard I remove the tool from the implant because it's very parallel. It's 5 degrees and it's very stable. Huh? I think, I don't know if you are in time. I excuse for the delay, but I think it was a very nice morning in Sofia. I hope to enjoy any ridge and also to enjoy this guided surgery, which you saw that is amazing.
So, Professor, I would like to thank you from behalf of the whole Sofia Dental meeting.
Thank you.
Thank you for your amazing demonstration and lecture. We would like
Thank
to give this present and this certificate.
Thank you, thank you.
Okay.
Thank you again.
Thank you very much.
We will be in 2 minutes only. The occlusal adjustments are done, and that's all.